Well, if you're working out like our super fitness weight loss challengers are, trying to drop that quarantine 15 as it's been called, then your feet might be taking a beating as a result. And Kelly Hybrader tonight has some tips and their doctor's orders, so you better listen.
Are you feeling like you have a little bit of pain in the hips or the knees? Well, sometimes it's not the workout, it's your shoe that you choose to wear. I have Dr. Erica Martin with me today. Dr. Martin, what's going on?
So I think the bigger question is, what kind of shoes are we wearing on an everyday basis?
Well, I kind of wear a little bit of a kitten heel.
Yes, which those are super cute. I love them. But I think we have to think a little bit about how these are impacting our feet and subsequently the rest of our body, okay? And so the first thing that I see, you got a real pointy heel, which is very cute, but again, it really crowds your toes together, okay? And then the other thing too is I really don't love heels on shoes, honestly, aside from very special occasions, because again, that's very hard on the heels themselves, but then also it kind of predisposes you to some hip and knee pain in particular. So I want to talk you through some kind of an easy way to see if your shoes are crowding your feet, which is really important to do. So I'll have you take your shoe off here. We've got a little bucket of water here. Yep. And so I'm just going to have you
foot in.
Yep, foot in.
Okay.
Perfect. And then come back out onto our cardboard here. Perfect. And then up off of the cardboard. Perfect. And
I love footprint.
Yes. So we have our footprint here. And what I like to do is I just like to kind of trace that before it dries up.
Okay. What is this showing us?
So this is just basically showing us the kind of true size of your foot. I'm not an artist, excuse me.
And the actual width when I push my foot down, right?
Exactly.
Pressure,
so that's showing, like where the majority of your weight is falling when you're making contact with the ground, which is ultimately what we care about with your shoe. And so here, as you can see, we are squeezing our foot into a shoe that is too tight for us. So that causes a lot of, this is what causes bunions in women.
Oh, it does.
So when we wear these cute little shoes that squeeze our toes, especially, and put a lot of kind of pressure on the toes, that's what causes bunions.
When we have, when we're starting a workout program, it's also a good idea to buy good tennis shoes, right?
Yep, absolutely.
So show me an example that we have of those.
Yep, so I am not advertising anyone in particular. Got a little stuff on them. But a good, like, kind of neutral support running shoe can be great. Now, it kind of depends on your activity. So if you're doing a lot of weightlifting, I would recommend like kind of a more weightlifting type focused shoe. But for most people, your general exerciser, something like this with good arch support and cushioning is going to be just fine, and a kind of a neutral support rather than anything more specific than that.
And if you have been wearing those tennis shoes for more than 6 months, I want you to get out and buy a new pair, because your body can really use some more support, right?
Yep, absolutely. So there are different theories about how many miles you should be putting on your shoes. Most people, we don't need to get that granular, but if you're seeing that, you know, the soles are starting to get worn down, you're seeing the kind of underlying sole on that shoe, that means it's time to get a new pair.
All right. I'm going to put her in the chair. Doctor, you go over there. I'm going to see if your shoes fit you right. Now watch. Those are your doctor's orders. Come on, take your shoe off.
Oh, geez.
5:51 coming up next, a look at how the Toledo Fire Department trains for